Good evening, this is Jonathon Fong coming from the Venice Ocala Heart Institute here in lovely, beautiful, warm, muggy Venice, Florida. I thought I'd start a new series with you today regarding some of the procedures that we do outside of heart surgery. One of the topics that is probably not well understood by the general public is the thought of aneurysms that involve different areas of the aorta. So I've brought along a little model with me today, and I just wanted to show you the different areas of the aorta that we deal with as heart surgeons. And this is the heart, and this red structure here is the aorta. It's usually broken into three segments that we think of. One is called the ascending, which extends from the aortic valve up to the artery that supplies your right arm. The arch, which encompasses the takeoff of the arteries to your arm and to your head. And then just after the artery to your left arm comes off, the descending aorta, which goes behind the heart. Aneurysms of these areas are things that we routinely handle. The aneurysms that we see most often that require intervention on a surgical basis are dilations or enlargements of this portion of the aorta, the ascending aorta. And that requires open heart surgery, and usually the placement of a graft, a synthetic material in this area. More recently, this is also the way we would handle repairing an aneurysm of the descending aorta. The approach to the ascending aorta is through the front of the chest, through the breastbone, and the approach to the descending aorta is between the ribs and the rib cage. But more recently, there's newer technology out there that allows us to approach the descending aorta via the arteries in the groin, not dissimilar to how one would undergo a heart catheterization to demonstrate the arteries of the heart. And I brought along yet another prop that demonstrates the catheter that would be used to deploy this graft. And here is the example of it. This is a long catheter that would go up through the groin vessels and would traverse into the descending aorta, and depending on where this aneurysm was, this would become unsheathed and it would dilate up and it would expand to fill the aorta and isolate the channel of blood and deflect the pressure away from the wall so that the enlargement would stop. This is a procedure that has revolutionized the treatment of aneurysms to the point where people can usually come into the hospital and just simply stay overnight, relative to the gold standard where you would usually be in the hospital for several days afterward and have to recover from the incision itself. So I just wanted to leave you with that today, and I'll explain a little bit more the next time we come together. So from Venice, Florida, we wish you a good evening. Thank you.